Okay. Um, okay. All right. So it is noon. So sorry, somebody just asked me for a link, so I'm going to send it to her right now. Okay, good afternoon. Before we get started on the presentation, I want to take care of a little bit of housekeeping. So, first of all, if I could ask you all to keep your microphones muted throughout the presentation, that would be great. And you are welcome to have your camera on or off. Uh, just also as a reminder, this is being recorded and I'm going to put it on YouTube. So if you don't want your face on the YouTube video, you should turn off your camera. And it's totally fine with me if you have your camera off. I'm not going to feel like weird about talking to a room full of no cameras, for lack of a better way of describing that. So, and yeah, I think that's all the housekeeping. Am I missing anything, Christine? Oh, sorry. Yeah, one other thing. If you have questions during the webinar, please put them in the chat or save them till the end. We're going to have a Q&A period at the end. This lovely lady here next to me is Christine Meekins, my colleague, and she is helping me with a lot of the technical stuff today. So if you want to send a question to just one person, she would be the person to send it to. You can put it in the group chat for everyone to see if you want, and if you want to send it just to one person, Christine would be the right person to send it to. So microphone's muted, cameras off unless you want your face to be on YouTube, and questions in the chat until the end. Okay. So I'm going to go ahead and get us started with today's presentation. All right, so this webinar is called Supporting Someone with Mental Health Challenges. And can everybody see my slides? If you can't see my slides, please put something in the chat. Okay, thank you. All righty. So everything in DBT starts with mindfulness, and this is no different. So we are going to do a mindfulness exercise to get us started. And this one is, we're going to be practicing a skill called mindfulness of thoughts. And we're going to be doing an exercise called leaves on a stream. If you've done this exercise before, this might be a little different than how you're used to doing it. I'm going to do it a little different today. So I'm going to give you some instructions, and then I'm going to be quiet for the rest of the exercise and allow you all to do it on your own. So if you could please get into a mindfulness position, and that means sitting comfortable yet alert. Close your eyes if you're comfortable closing your eyes. If you're not comfortable closing your eyes, then simply let them go out of focus a little and try not to look at your computer screen. Okay? So I'm going to invite you to imagine yourself sitting near the bank of a gently flowing stream. On the surface of the stream are leaves floating by. Throughout this exercise, anytime you notice that a thought has entered your mind, I want you to notice that the thought has entered your mind and then place it on a leaf and let it float by. We're simply observing our thoughts and then letting them float by. If a thought sticks around and doesn't seem to want to float by, just put it on a leaf again. And if your attention wanders away, your mind wanders off to something else, that happens. It's really normal. It happens to me every time I practice mindfulness. Notice that that's happened and gently bring your attention back to the exercise. I'm going to mute myself and set a timer, and I will let you know when the timer is done. Okay, that's time. So I'm going to invite you to open your eyes and return your attention to the room. And if you'd like, you're welcome to share with us anything that you noticed during that exercise, um, things that came up for you, the way that you felt, and you can either unmute yourself and share it out loud, or you can put it in the chat. Would anyone like to share?
It was pleasant, and I like the idea of the leaves taking the thoughts away.
Thank you for sharing. Yeah, I like that too. It helps to have a visual, I think, when you're trying to notice your thoughts coming and leaving. And what we were practicing there is the DBT observe skill, observing our own thoughts. And we can observe lots of things. One of them is our thoughts. So that's what we were practicing today. Okay, wonderful. Well, thank you all for being mindful with me. Christine, is there anything in the chat? No, okay. Okay, so let's move on. So before I get into all the rest of what we're going to talk about today, I'm going to just tell you who we are so you know who's talking to you. So Gladstone has a comprehensive DBT program. We also have other stuff at Gladstone too. We have psychiatrists and nurse practitioners and non-DBT therapists and assisted psychotherapy and um, TMS and a weight management program. We have lots of mental health services. Um, I am part of Gladstone's DBT program, and so is Christine. She and I are DBT people. And so we have a comprehensive DBT program that offers full fidelity to the model developed by Dr. Marsha Linehan, who was the psychologist who created DBT therapy. We are the first Maryland program to be certified by the DBT Linehan Board of Certification. We offer DBT for adults and adolescents ages 14 and up. Our DBT program includes individual therapy, group skills training, and 24-hour phone coaching. And the adolescent program also includes family therapy and parent coaching. These are our goals for today. So, if you have someone in your life who suffers from a mental health problem, which I'm assuming most of you do, and that's why you're here, right? So, our goals are for you to understand what your role is in supporting that person and their mental health. We're going to help you learn some effective communication strategies to use with your loved one. We're also going to help you learn about some invalidating statements to avoid. These are statements that can hurt your loved one. And also, we want to teach you how to set and enforce boundaries and reduce or hopefully avoid feeling burnt out because that is a real risk for people who are helpers. And also learn when to seek emergency help if necessary. So let's start by talking about some of the challenges that exist with supporting loved ones with mental health needs. These are some things that I've personally heard from the families of people that I work with. They're afraid of saying the wrong thing. Um, and that's a real fear. There are wrong things to say, right? That could hurt or cause a problem in your relationship. They may be frustrated that they've been trying to help and the help doesn't seem to be helping. And they also might be experiencing burnout from a high level of need. The person who you're trying to help, they might need so much help from you that you're feeling burnt out, right? So we're going to hopefully work on alleviating some of those challenges today. So let's talk about your role. Your role in supporting your loved one depends on a number of things. It depends on your relationship with the person. Clearly, a friend and a family member are different people for this person and are going to be able to provide different levels of support. And a coworker or a boss or a teacher, another completely different relationship, right? So your relationship with the person is going to play a big role in what your role is in helping them. Obviously, of course, um, what the person wants or needs for help is going to make a big difference. Your helping skills matter, right? If you are really, really great at researching providers in the area and you know a lot of resources for doing that, then maybe that's your role, right? And maybe somebody else is really great at listening and saying the right thing, and that's their role. So your helping skills matter. And then, of course, your limits. Your limits are what you are willing and able to do to help this person. And we're going to help you figure out what your limits are a little bit later in this presentation. What is not your role is to fix or treat your loved one's mental illness. These conditions are really complex. They're complex health problems and they require professional treatment. And professionals go through a whole lot of training to be able to do this. And even there are people with mental health problems in my family and among my friends, and I am a trained and licensed DBT therapist, and it is still not my job to act as that person's therapist. If I had a person in my family experience a serious mental health crisis, I would call their therapist, or I encourage them to call their therapist in order to get that um, therapy and treatment. I would not try and treat it myself for many, many reasons. So even if you did have the training, it still wouldn't be your job to fix their mental illness. Okay, so let's start by talking about some communication strategies. The first communication strategy we're going to talk about is validation. And this is kind of a buzzword for the last, I don't know, 10 years or so. People have been saying it a lot in pop culture. And so I want to explain what it means because sometimes people misunderstand it. Validation means that you are creating space for your loved one to express their feelings without immediately jumping to solutions. And you're communicating to them that their feelings or thoughts or actions, or maybe all three, make sense in some way. You're communicating that you get it or you're trying to get it, and something about it makes sense. And it's really the absolutely most effective communication tool that we have. Let's talk about why. What is the reason that validation is so powerful, and why do we talk about validation so much in DBT? Why are we constantly talking about validation? Well, number one, it improves relationships. You know, if you've ever been in a relationship with somebody who was frequently saying stuff to you like, I understand, I get it, that makes sense, you probably have noticed that it feels a lot better to be in a relationship with that person than with another person who just kind of acts like, that doesn't really matter that much, or maybe even communicates to you that they don't think your feelings make sense. So validation improves relationships. It also reduces negative emotions and the pressure to prove who's right. People can disagree about something or feel different ways about something, and they can both be right. My perspective, or even think about the classic example that we talk about in DBT a lot is a tiger is chasing a man, right? And the man's running away and terrified. And for the man, it's like, this is terrifying. This is horrible. What's it like for the tiger? Yum, right? Like the tiger wants dinner. So two people can be looking at the exact same situation and feel completely different about it, and they can both be right. Both their feelings can be valid. Um, it also makes problem solving, closeness, and support possible. It is really difficult to problem solve with someone who's acting like you just make no sense at all. Um, and i- it's a lot easier to do that when the person is trying their best to understand you and, doing their best to think about what you're saying makes sense. And also, invalidation hurts. Right? We have lots of scientific evidence to prove this. And also, I've got a lot of anecdotal evidence from my clients. When people are frequently invalidated throughout their lives, it worsens their mental health. And even if it doesn't happen over and over again throughout their entire lives, each instance of validation can hurt. So let's talk about what to validate. Um, so you're going to validate the person's kernel of truth. That means whatever it is they're saying, you're finding the part of it that's true, and you're going to validate that. You're going to validate only the valid and never the invalid. And you can validate the person's feelings, beliefs, or thoughts. Okay, so um, let's say, for example, that I have a friend who keeps on telling me that she's fat and ugly, and she feels scared to go out in public because people are going to see her and see how ugly she looks, and so she stays home. I am going to find her kernel of truth in that, and that's that she's feeling anxious about people seeing her in public. That is true. I may not like that it's true, and it's still true. I'm not going to validate anything that's invalid about that. It is not valid that my friend is fat and ugly. No, you've never seen my friend before, and this friend is fictional, and I'm still going to say with 100% certainty that she is not fat and ugly because I just don't believe that about anyone. Um, so her kernel of truth is that she feels anxious and doesn't want to go out because she's afraid that people will look at her. And the invalid part is the fat and ugly part. So you validate the valid and not the invalid. And remember, every invalid response makes sense in some way. And validation is not necessarily agreeing, and it doesn't mean that you like it. All right. So if I've invited that friend to a party and
Yeah,
I'm gonna mute this. There we go. If I've invited that friend to a party and she says she's not gonna come because everyone will be looking at her and seeing how fat and ugly she is, then I'm going to recognize that something about her response makes sense. It makes sense for a person to not want to go to a party when that person is afraid of people looking at them because there are people at parties, right? So if somebody is afraid of people looking at them, of course they don't want to go to a party, right? So remember that every invalid response, it's not valid that she's fat and ugly. So that's the invalid part of the response, right? And her not wanting to go to the party does make sense. And I don't have to agree with her that going to the party would be a bad idea or that people would stare at her if she came. And I also don't have to like that she doesn't want to go to the party in order to validate that she doesn't want to go. So let's talk about how to validate. So the first step is to pay attention to their thoughts, feelings, and actions. Just notice. Notice what this person is expressing and reflect that back to them by describing their thoughts, feelings, and behaviors in non judgmental language. So, if I'm going to try and validate my friend that I was just talking about, I'm non judgmental language would be like, it sounds like you're feeling really anxious and you don't want to go to that party. Not judgmental language would be, um, you have this crazy idea that you're ugly and you don't want to go to the party. Right? So I'm going to use non-judgmental language to reflect back factual statements about what I can observe, and what I've noticed about their thoughts, feelings, and actions. Okay. You can also try to, and this is an advanced skill, you don't have to do this part. Okay. You can try to read minds by being sensitive to what's not being said. So let's say that I invite my friend to the party and she doesn't say people are going to stare at me because I'm fat and ugly. She simply says, no, I don't want to go. And when I say, oh, come on, I really want you to come, she gets irritated and snaps at me, right? So I might know from past experience that this person is frequently afraid that people are going to judge the way that she looks and stare at her. So maybe I might say, hey, are you worried about people looking at you and thinking that you don't look nice? Is that the reason you don't want to come? That would be reading minds. What's really important is two things. One, that you're considering the situation and what you know about the person in order to help you read their mind. And number two, you got to be open to correction because I could be wrong. She could not want to come for a completely different reason. Um, she could be upset with me about something that happened yesterday, and that's why she doesn't want to come. Right? So I have to be open to corrections. If you are insist, no, no, I know this is why you don't want to come. I know that you're thinking that people are going to be staring at you, and that's why you don't want to come. That would be invalidating if she is trying to tell me, no, you're wrong. Okay, so make sure that when you do the mind reading that you're open to correction. Step 4 or level 4 validation, we call it in DBT. You're going to understand how their emotions or thoughts make sense based on their history, their state of mind, or current events. Okay. So, what does this mean? Someone's emotions might make sense based on their history. If um, I know somebody who doesn't, who's they're telling me they're terrified of getting into a car and driving somewhere, and I know that this person had a terrible car accident several years ago, then their emotions make sense based on their history, right? Yeah, I get why you're afraid to get in this car. Even if I think that getting in this car is perfectly safe, and even if I can demonstrate with facts and data that getting in this car is perfectly safe, it still makes sense that you're afraid of it because you had a terrible car accident. Of course you feel afraid of it. That's a scary thing to go through. Their emotions might also make sense, or their thoughts may make sense based on their state of mind. Okay, so somebody going through a major depressive episode is going to look at everything through a depressed lens, right? So if I have somebody in my family telling me that there's absolutely nothing to do and everything is going to be just miserable and terrible forever, and I know that this person is going through a major depressive episode, then I can validate for them, like, I bet it feels that way right now because you feel so depressed, right? Or I might know something else about their state of mind, like they didn't get any sleep last night, or they haven't eaten all day. Something might be making them vulnerable, like they just had a fight with their significant other, right? So something about their state of mind might make their emotions or their thoughts make sense. And then current events. Um, that means whatever is happening right now, their emotions might just make sense for the situation, right? Um, like a teenager who is all ready for prom and they're sitting there in their prom clothes waiting for their date to pick them up and the date doesn't show and they're crying. Hey, that makes sense, doesn't it? If what's happening naturally leads to that emotional state, then their emotions make sense based on current events. Okay, so level 5 validation, or another thing you can do to validate, is acknowledge the valid by saying it out loud or giving functional validation. All right, so when I say out loud to the person who's waiting for their prom date, um, I am so sorry that you got stood up. That must feel awful. That's validating by saying it out loud. I'm saying to them, this is why I think your emotions make sense. Or I'm sorry that it feels so scary for you to get into a car. It must be really hard for you to get places. Um, and I understand why you don't want to because you had that car accident, right? That's saying it out loud, validating by saying it out loud. Giving functional validation means doing something, validating to the person. So I have a coworker named Jim who always gives this example that if I step on your foot and you go, ow, and I say, gosh, I'm sorry, it must really hurt to have me stomp on your foot, but I don't remove my foot, I'm not really validating, right? So functional validation is removing my foot from your foot. Or if someone says they're cold, giving them a blanket. Or if someone says, I really just wish um, I really just wish that my house wasn't so horribly messy and I come over and help them clean up. That's functional validation. Okay. So doing something that helps alleviate the problem is functional validation. And then treat the other person as equal, not as fragile or incompetent. So if I start acting like, oh, you poor thing, you think that you're fat and ugly and you don't want to go to parties, um, come on, let me do your makeup for you. Let me show you how to dress to it like an adult person who already knows how to do makeup and put on clothes. That would seem pretty infantilizing, right? So don't treat them as fragile or incompetent. Treat them as equal. And also don't try to one up. Like, oh, you think you've got it bad. Look at this zit on my face. I'm even uglier than you, right? Um, no one upping. That's not treating the person as equal. Okay? Does all that make sense so far? If you have any questions, feel free to put them in the comments. And I want to just talk about invalidation a little bit more, okay? So, studies consistently demonstrate that people who were invalidated experience stronger physiological arousal. That means like your heart beating faster, sweating, things like that, more intense negative emotions, and they had more difficulty labeling and understanding their emotions. So invalidation even makes it difficult for that person to even know how they're feeling. And in fact, studies even show that if a person is being consistently invalidated, right, and their emotions are um, are real dysregulated as a result of the invalidation, if if the people around them simply stop invalidating, they don't even have to validate. All they have to do is stop invalidating, and that person's mental health gets better. Now, of course, if they validate, it's going to get even better. But stopping the invalidation helps improve that person's mental health. Invalidation really hurts and it destroys relationships and it makes their behavior even more volatile. So, for example, if my friend is telling me she's fat and ugly, and I say, no, you're not, I'm invalidating that statement, right? Her response is probably going to be what? Yes, I am, right? She's going to dig in and she's going to start believing that even stronger. She's going to start trying to convince me that she's fat and ugly. She's going to be like, yes, I am. Look at my nose. Look at my hair. And no matter how much I argue with her, she's going to keep arguing back because invalidation puts people in a position where they feel like they have to prove to you that their feelings are valid. Whereas, validating the valid instead of invalidating the invalid, validating the valid gives them something to help them feel like you understand them. And they don't have to argue with you anymore. They don't have to prove to you that their feelings are accurate. And frequent invalidation can even be traumatizing. There's something called traumatic invalidation that's more serious than what we're talking about here. Um, this kind of invalidation can build up to traumatic invalidation over time, and it's usually by really important people and communicates to the person that something about their own identity or way of being is wrong. And I've personally treated people who have PTSD symptoms, like meet the criteria for PTSD because of traumatic invalidation. So here are some invalidating statements to avoid. Everything happens for a reason, right? Um, the the teenager who just got stood up by their prom date is not going to be comforted by everything happens for a reason. Oh, what's the reason? That I suck and nobody likes me, right? Um, there's no like larger meaning to that or good that's going to come out of that person being stood up. You need to stay positive. That's another invalidating statement. Everything happens for a reason. You need to stay positive. Oh, it's not that bad. Others have it worse. This communicates to the person that they're just not thinking about it the right way. The reason that they're feeling hurt is because they're wrong about the situation. If they would just think about it a different way or just stay positive, then everything would be better. And that's not true. Okay. You can't think positive think your way out of a mental illness. Have you tried exercising or meditation or this supplement? That's another invalidating statement. Why? Because you're jumping into a super simple solution that makes it sound like their mental health could be cured by something that like lots of people do that's easy. And if they would just have tried this thing, then they would be feeling better. So they might take away from that that the reason that they're mentally ill is because they're lazy or they're just not willing to do what needs to be done, right? If somebody asks you, do you know some exercises I could do that might help me feel better? Sure. Go ahead and give them the suggestion. If somebody asks you, do you know about supplements that help with mental health and you do happen to know about that? Sure. Go ahead and give them your advice. And we don't want you to just jump in with super simple advice that um, isn't likely to work and sounds way easier than it is. I once had my daughter had a serious medical problem years and years ago that put her in the hospital for 2 weeks. And it was something in her intestine. There was a blockage in her intestine. And I remember one of my aunts said, "Have you tried prune juice?" And I thought, my daughter is hospitalized and might have to undergo surgery. I don't think prune juice is the answer, right? If it sounds too good to be true, it probably is. And suggesting that this too good to be true thing is going to help might feel invalidating to the person you're trying to help. And then, of course, this wouldn't have happened if that's just another way of blaming them, right? So these are all invalidating statements to avoid. All right, so let's talk about, we're moving on from communication strategies and we're going to talk about practical ways to help. So here are some practical things that you can do for someone in your life who has mental health challenges that might be helpful. And remember, you're only going to offer this help or do this for them if they want the help. If they don't want the help, that is their prerogative. They do not have to accept your help. Okay, so some things you could do would be assisting with daily tasks like chores, or if they're your child, you can put out their medications for them, right? Um, or give them rides places, right? Those are daily tasks you can help out with. You could accompany them to appointments. Some people are really scared to go see a therapist, especially for the first time. So it might make them feel better if you are sitting with them and going to their appointment with them. You could help them research treatment options. We have seen so many people at Gladstone who they've been in therapy or seeing some sort of mental health provider for years and nothing's worked, and they're feeling hopeless and wondering if anything's ever going to work. And it might be that they haven't tried the right treatment yet, or they might not have been connected with the right provider yet. So, a practical way to help them might be researching other options for treatment. And then another practical way to help would be assist with applying for accommodations. Many people aren't aware of this, but a lot of employers will give you accommodations at work based on a mental health diagnosis. And I've written letters for people, for my clients who are applying for accommodations at work. Not all employers will do this, but lots of them will. And they could get accommodations like time off of work to attend therapy appointments, or even being allowed to take frequent breaks from work in order to use their mental health, their coping skills that they learned in therapy. Lots of accommodations are available. And of course, there are always accommodations available in schools for children and teenagers who have mental health problems. So helping and applying for those accommodations can be kind of overwhelming for people who have mental health challenges, or even for anybody. I don't know about you, but I do not like filling out a bunch of paperwork or trying to figure out what paperwork I need to fill out, right? So helping somebody with that stuff is a practical way to help. All right. Let's talk about setting limits. So, in order to be able to set limits with somebody, you first have to know what your limits are. And it's also true that for many people, it's really difficult to know what their limits are until their limits have been crossed, right? So it might be that the way that you figure out your limits is by having your limits crossed, or another word for limits is boundaries. The way you figure out your boundaries is by having them crossed. And I hope that that's not the case with all of your boundaries, and it certainly might be the case with some of them. So remember that you don't have to have a permanent list of boundaries etched in stone and those are your boundaries forever. They could change over time based on new information. Somebody crosses a boundary you didn't realize you had, you're always allowed to add that to your list of boundaries. Okay. And here are some questions that you can ask yourself to try and figure out what your boundaries are in advance. So, what am I willing and unwilling to do? For example, I will listen and provide validation. I will not answer the phone after midnight, right? So, what are you willing and unwilling to do? What behavior am I willing to accept? For example, I know I don't like being yelled at or insulted. So if I'm talking to a loved one and I really want to help them and they start yelling at me or insulting me, I'm going to lovingly end the conversation. I might say something like, I'll talk to you when you're ready to speak to me nicely. And then I will hang up the phone or walk away. Um, how much time do I have available to help? Most people have jobs or school or a family, children to take care of, or, something else that they're committed to. I don't think I know anybody who has absolutely nothing that they need to do in their life besides take care of another person, right? So you need to ask yourself how much time you have available. And then ask yourself, what will I do if I start to feel overwhelmed? It's really important to have a plan in place for what you're going to do when you start to feel overwhelmed, because it probably will happen if you're giving lots of help to someone. You probably will eventually start to feel overwhelmed, at least a little. And if you have a plan in advance for how you're going to handle that, maybe some coping skills that you're going to use, maybe the plan is that you're going to take a little break from helping them, whatever it is, if you have that plan available in advance, that will hopefully prevent you from blowing up at the person when they ask you for help, or something that you really would regret doing. And then another question to ask yourself is, has this person ever needed help from me that went too far? Okay. You know, they're calling you in the middle of the night asking you to come pick them up from somewhere that's a 6-hour drive away. To me, that would be too far. So if have they ever needed help from you that went too far? That might help you figure out what your limits are as well. So, how to enforce your limits? I know a lot of people who are confused about the way that boundaries work. I've heard people say things like, um, I've told my daughter that I'm not going to give her rides after midnight, and she keeps on calling me at 2 a.m., and I have to go pick her up. You have not set a boundary, if that is what you're saying. Setting that boundary means you don't answer the phone after midnight and you don't go pick her up. That boundaries are for you. It's only a boundary if you're saying, I will not do this thing. A boundary isn't you can't do that thing, it's I will not do this thing. So a boundary would be, I'm not going to go pick you up after midnight. A boundary is not, you can't call me. If you call me, my phone will be turned off. If you call me, I'm not going to answer. Those are boundaries. I hope that makes sense. So it's really unreasonable to expect someone else to respect your boundaries if you don't respect them first. Okay. So you need to know what you're going to do if that person crosses your limits or crosses your boundaries. Um, So like the example of somebody yelling at me on the phone or insulting me is an example. One of my limits is I will not listen to people yell at me or insult me. And so I have to not listen to it. I have to hang up the phone. I have to walk away. It doesn't mean that I stand there and go, "You're violating my boundaries right now. Stop yelling at me and stop insulting me." That's not enforcing a boundary. Enforcing the boundary is leading the conversation so they can't yell at me or insult me. Or if I can't leave for some reason, like we're in a car together, let's say, um, turning my attention elsewhere so that I'm not listening to it. That would be enforcing the boundary. Okay. Um, and again, if you have any questions, please feel free to put them in the chat and recognize signs of burnout. Okay. So in our DBT consultation team, we assess each other for burnout every single week. This is really important for helping professionals, and it's also really important for loved ones. So watch out for symptoms like persistent fatigue, irritability, withdrawal from your social circle, or feelings of resentment toward the person you're supporting. If you're feeling any of those or noticing any of those symptoms, these are signs that you need to adjust your level of involvement. All right, when to seek emergency help. All right, so sometimes you are not going to be sufficient help for this person. They might need emergency help. If somebody is making suicidal statements or um, showing or some behavior like writing a suicide note or something like that, making a suicide attempt, any kind of suicidal statements or behaviors, that is a time to call 988 or 911 or go to the ER. And again, I am a DBT therapist. I specialize in treating people with suicidal thoughts and behaviors. That is almost all I do all day is treat people with suicidal thoughts and behaviors. And if somebody in my family were making a suicidal statement, I would call someone else for help because I am not the right person to treat their suicidal thoughts and behaviors. If they have an inability to care for their basic needs, like they're not showering, they're not brushing their teeth, they're not paying their bills, they're not cleaning their house. Psychotic symptoms, these are hallucinations or delusions. If they're seeing things that aren't there, if they believe that, aliens have implanted a chip in their brain or something like that, those are hallucinations and delusions or psychotic symptoms, and that's a time to ask for emergency help. Or if they're displaying aggressive behavior that threatens anyone's safety, your safety, their safety, anyone's safety, that's also a time to seek emergency help. Okay. All right, so let's do a practice exercise. Sandra is the 52-year-old mother of Marcella, who is a 24-year-old woman with bipolar disorder. Sandra is very worried after Marcella called her to say that she's dropping out of college and quitting her job. Sandra drives over to Marcella's apartment and lets herself in with her key as usual. Inside, she sees that the apartment is very dirty and there are insects crawling all over the kitchen. Sandra finds Marcella in her bed awake. She asks Marcella what's going on, and Marcella replies nothing in a robotic tone. Sandra says, "You're not really quitting everything, are you?" And Marcella bursts into tears. She yells, "Why can't you ever be on my side?" Okay, so what I'm going to ask you some questions. You can either unmute and answer them out loud, or you can type into the comments if you'd like. So, what can Sandra do or say to validate Marcella? Any ideas? What can Sandra do or say to validate Marcella? Okay, so I think that one thing that she could say would be like, "I'm sorry, I didn't intend to make you think that I'm not on your side. It sounds like you're feeling really depressed. Can you tell me what's going on? That's something she could say, right? I'm here and I really want to help.
Buddy in the chat said, you could say, you must feel so bad.
Yeah, that's great. You must feel so bad. All right, what are some practical ways that Sandra can support Marcella? She could help clean the apartment, right? Any other thoughts?
Someone said, offer to help.
Yeah. Offer to say, what can I help you with? Okay, and what are some ways that Sandra could set and maintain boundaries with Marcella? She can, determine what she's willing to do. Maybe she's willing to clean the apartment. Maybe she's not. Maybe she doesn't like bugs. And she can say, I'll call an exterminator for you, but I'm not going to clean this up. What else could she do?
Someone said, I have a couple of hours. I can help you clean the kitchen.
Yeah, perfect. Perfect. Okay. All right. So that is the end of the presentation. I'm going to take some questions. And we're also going to did you already put in the chat the link for the evaluation form, Christine?
I did, and I just put it again as well.
Okay, thank you. So I'm gonna take this down. There, we have an evaluation form. If you wouldn't mind filling it out and letting us know what you thought about this presentation, or if anybody has any questions, I'm happy to take them now. And also, if anybody is interested in DBT therapy at Gladstone or any kind of services at Gladstone, we're happy to take those questions too. Or you can email me or put that in the form, in the review form. Okay, well, it looks like we don't have any questions. Thank you so much for joining us and paying attention and for supporting your loved ones. That is very important. Really, thank you for all that you do for the people that we treat. It makes such a huge difference in people's lives when they have loving people in their families and friends groups and wherever that they can rely on for support. So thank you so much for all that you do.
I'd just like to say that I appreciate the presentation, but particularly not for many years I didn't know what invalidating my own limits and boundaries were. And I particularly liked the explanation that you gave about what that means. And that it's important to know when you're doing that.
Good, thank you. I'm glad that you liked that and that helped. Okay. Well, thanks again, everyone. And I believe you all have my email. So if you think of something later, feel free to send an email. And I am going to be sending out the video recording and the slides to everyone who registered. So you should have that in your inboxes soon. Thanks again. Have a great day.
You too.
Thank you so much. This has been very, very useful.
Good.
Little bit of it a review for me. My husband is bipolar and we've been dealing with that for a while, but
Okay.
Sorry, I'm going to start crying. I needed to hear stuff for me. Thank you.
Aw.
Thank
Thank you
you.
for being here and for supporting your husband.
Appreciate it. Okay. Bye-bye.
Bye.
Bye.
Bye.